Hi, I'm Dr. Chuck. Welcome to Your Filthy Mouth. Today we're going to be talking about all things enamel. Stay tuned. Let's see what you can learn.
Your smile is beautiful and possibly deadly. Dr. Chuck is here to tell you how your mouth can hold the key to your overall health. Now, about that filthy mouth of yours.
Hi, I'm Suzanne Lynn with Dr. Chuck, and this is Your Filthy Mouth. We're glad that you're here. And we're so excited because today we're kind of giving homage. We're dedicating this show to our listener and viewer, JP, who wrote in, wants to know all about enamel. And he's got some great questions. Dr. Chuck, let's start with the basic. I mean, enamel, we've heard the word, we hear it on toothpaste commercials, but what actually is enamel? Why is it so important?
Well, enamel is the outer shell of a tooth. So you have enamel on the outside. The next layer inside is called dentin. The dentin is 700% softer than the enamel on the outside. So enamel is very strong, but it's not indestructible.
Okay, it's the protector, though.
That's the part you see.
Right.
That's the part you chew with. That's the outside part of the tooth.
Okay,
Yeah.
all right.
But once it forms, that's it.
All right, well, that's a great springboard to JP's question. The first one was, when are teeth formed? Do they exist when we're born, and do they grow before they erupt?
Well, yeah, there are a lot of questions right there, JP. Good questions. When a baby's born, it has generally tooth buds already in the jaw, the upper jaw and the lower jaw. And they are forming teeth. They're becoming that way. Occasionally, a baby will be born and already has a couple of teeth in there.
Okay.
But that's unusual. Okay. Usually, they wait until they're 4, 5, 6 months old, and they start coming in. They come in a certain sequence. But when you have that tooth bud, it's kind of like a seed, and it has to grow, and it develops into a tooth. And that just takes time. So, but when the tooth, once that tooth sticks up out of the gums, and teething is so much fun for babies.
Oh my gosh, so much fun for nursing moms too.
Yeah. It's got to work through the gum. But now it's susceptible to whatever foods are going in that baby's mouth. So if the baby's having water, that's fine. If they're having Gatorade or Mountain Dew,
it's affecting
that's not
their
so
teeth.
Good for the teeth. Yeah.
Even as just newly bursted little buds, it's being affected.
Well, what happens is the bacteria in their mouth, and by the way, when a baby is born, it does not have the bacteria that can cause cavities. It's not there.
Wow.
It picks it up from mom, dad. You know, they're take the binky, you know, and wipe it off with their mouth.
Right.
Or share a straw, kisses.
Right.
Yeah,
Mm-hmm.
Absolutely. Mm-hmm. So generally, you're going to find the same bacteria in the mouth. In one mouth that you can find most of the mouths in the family because it seems to go around.
Okay.
So once that baby has the bacteria that can cause cavities, then when you're feeding the bacteria with sugars, with sugar water, with apple juice, with milk, and let them sit with a bottle, that now you're giving the bacteria the food that they need to produce the acids that are going to destroy the teeth.
Good. All right, JP. Second one is the enamel that exists, what we live with, is that like for the extent of our life?
That's my understanding. There are some toothpaste that claim they can rebuild enamel.
Okay.
And
What
I'm
do you
not
think
saying
about
they're
that?
wrong. I'm just withholding judgment on that.
Okay.
To me, it's much, much, much better to prevent that problem, that demineralization of the tooth from the outside from the very beginning, rather than try and build it back up. Maybe you can. Maybe there are some things that can help rebuild the enamel. But
What made it break down in the first place?
well, the acids.
Okay.
Again, it's the acids that are being produced from the bacteria that are using the sugars, the foods, the starches that are turned into sugars.
So what we're eating is really affecting, long term.
Big time. In fact, they were looking at prehistoric skeletons they found in Africa. And throughout Africa, they didn't have cavities, didn't have cavities until they got to this one area where they found cavities. They had honey in that area.
Oh, no kidding.
Yep. And so they were eating honey. Well, do you think that is the sugar? Yes.
Sure.
So another thing that just blew my mind was those African girls that were kidnapped and then released here not too long ago.
Right.
And I remember watching them on TV as they were smiling. They were so happy they were out. But these young ladies had the most beautiful smiles. They didn't have missing teeth. They didn't have cavities. And I just about can guarantee you they didn't have a toothbrush either when they were in captivity.
Sure.
But because of what they were eating, that had a huge effect on their dental care.
Wow.
Yeah.
That's
does our diet
amazing.
play a role in our dental health? Absolutely.
We'd have to say yes.
Yeah. Yeah.
So I think we kind of answered number 3, but JP asked, can an improved diet positively impact enamel? And what about the topical applications?
Okay. Yes, your diet can certainly help because you're not going to be breaking down the enamel that you have up there. And the topical application of certain things, certain fluorides, there's one thing when you put fluorides on, it forms a layer called fluorapatite, which is a little harder on the tooth. So it makes the tooth a little bit more resistant to cavities.
Okay.
But we talk about babies, but on senior adults, they have a really high cavity rate of the root surface. So if you can get the fluoride on the root surface of these teeth, you're making them more resistant. You can't guarantee you're never going to get a cavity because you
Right.
still have to keep your mouth clean, but you're much more resistant to decay.
So fluoride application is a good idea.
Absolutely.
Yeah,
Absolutely.
okay.
Unless you're allergic to it.
Right.
And there are some people that they just can't have it. But that's the minority. That's not the majority.
And then the last question JP asked when he wrote in to yourfilthymouth.com was, like bone, does poor nutrition leach minerals from the enamel, tooth structure, and supporting bone, and can it be reversed?
Yes, it does leach, but no, it cannot be reversed. And that's my understanding. And the science may prove that they have something where they can remineralize the enamel. But again, my thing is let's not let it get bad in the first place. Let's keep the tooth really clean. And it's really so simple. If you can keep the bacteria off of the teeth without damaging the tooth or the gums, now even if you do have some sugars and some things in there, you don't have the bacteria to produce the acid that are going to demineralize the tooth.
Okay.
Now, if you're drinking a bunch of Mountain Dew and you have really good clean teeth, you might not get cavities, but it sure is going to be affecting your diabetes, affecting the rest of your body. So it does have an effect on your body. But the cleaner you keep the teeth, and I'm back to the most simple thing because I'm going to say it, dental care is not expensive. Dental neglect is very expensive. And it takes 5 to 7 minutes to properly clean your teeth. The average person spends 30 seconds. And they wonder, why did I get all these cavities?
Right.
Well, you're leaving the bacteria on your teeth. And the bacteria takes the food that you're eating, converts it into acids, demineralizes, causes cavities on your teeth. So the cleaner you can keep your teeth, man, the better it is for everybody. Especially
JP.
your wallet.
Yeah, right. I know.
Yeah.
We can't miss that part. He said, especially your wallet. JP, thank you for writing in. You exactly are like the perfect viewer for us because we want people who might be just somewhat interested about mouth care to find these shows and go, oh my gosh, I have a renewed interest in how important this is. So thank you. Would you share these shows with friends? You can do that by subscribing and hitting the like button. But thank you for not just watching and being a participant, but for taking time to write in such great questions.
Well, our goal is to help spread the word about the importance of oral health and the things that you can do at home that are very inexpensive. Just going to take a little bit of time with doing that, and how that's going to help your overall health, not just your oral health, but your overall health. I mean, it's related to cardiovascular disease, diabetes, Alzheimer's disease. Now they're finding oral bacteria in the brains of Alzheimer's patients, rheumatoid arthritis, pregnancy complications. What does that have to do with the mouth? The mouth is connected via the bloodstream to the whole body.
All right. Well, we are going to get to another question of the week. Thank you again, JP, for writing in. We'll be right back.
Here's Dr. Chuck's question of the week.
Hello, Dr. Chuck. This is Jeff. How often should I replace my toothbrush?
That's a great question. I mean, is it based on how long it's been? I've heard 6 months. What do you go by?
Well, it kind of depends on how you brush your teeth. Jeff has a great question, by the way. Generally, it's about every 3 to 4 months. If you look at the bristles on your toothbrush, as soon as they start going like that, you're not doing a really good job,
Right.
And the thing I recommend to everybody to find out if you're doing a good job is use disclosing tablets, disclosing solution. You can order that right from Amazon. It's over the counter. But that way you're staining the bacteria that you missed after you brush your teeth. So you brush your teeth, floss your teeth, clean your teeth, chew up one of those tablets, rinse your mouth out, take a look inside there, and if you see a bunch of blue or red areas that you missed, go back and clean those off. But that might tell you, hey, it's time to replace my toothbrush. It's not doing as good a job as I thought it was.
I saw recently that there's a new toothbrush that has a water pick that has a water irrigator built in. So they're always improving, right?
Yeah, I am not hung up on any particular toothbrush, any technique. The whole idea is to get the bacteria off your teeth without damaging the tooth or the gums.
Okay.
There's more than one right way. There's way more than one wrong way.
But generally speaking, soft bristles.
Yeah, soft bristles.
Okay.
Yeah.
Okay.
Yeah. Again, the root surface is 7 times softer than the enamel. So if you're getting there with a hard toothbrush and you go like this, you can wear notches into the teeth. And I've seen those notches go all the way into the nerve of the tooth where you had to do a root canal on the tooth.
Oh, wow.
Not because of a cavity, but because of an improper technique. Not because of a bad attitude, a wonderful attitude, just a bad technique.
All right. Jeff, there you go. 3 to 4 months for a new toothbrush. All right. Well, we've been talking about enamel and the 3 takeaways. Well, number 1, you don't get a second chance.
When the enamel forms, that's it. So you want to take care of what you have. It's not going to repair itself. The cleaner you keep it, the less trouble you're going to have. It's that simple.
Mm-hmm. Okay. The second thing is that there's some stresses in life or maybe hormone changes that we can go through that cause differences and changes in our mouth.
The stress plays a role. Women with pregnancy, that's a big deal. They go through pregnancy gingivitis, and so now the gums are a little bit more inflamed. They bleed easy. Used to be people say, "Oh, the baby sucked all the calcium out of my teeth." No. It was you didn't clean your teeth as well because your gums were a little bit sore, and
it maybe hurt. Okay.
So you have to have this decalcification caused from the acids that are produced from the bacteria eating the sugars and different things that we're eating. So. If you can keep the mouth really clean, number 1, the gums aren't going to be as inflamed, so they're not going to be as tender. And number 2, you're not going to have the acids dumping on the teeth. Okay. So it's a whole lot better. Of course, women have the pregnancy, you have their breastfeeding, which is a great thing to do, but still you can go through the hormone changes. Right. And menopause, that's another time. You've got these hormone changes. Periodontist will talk about an episode where things are going along really nice, and all of a sudden, wow, the bottom fell out. What's going on? Well, could be hormone changes.
Interesting. And the third takeaway from today's enamel show is that it doesn't heal itself. No, the enamel doesn't. So that's why if you do have some decay, you can have, it goes in different stages. It doesn't go from really good to bingo, you got a cavity. You go through a demineralization process, and you might see these white blotches that are on the teeth. You're becoming demineralized. So there are certain toothpaste that claim that they can remineralize that and take care of that. If so, that's wonderful. I haven't experienced that. I've heard salesmen tell me that it's going to work, right. But I just really haven't seen those white blotches go all the way away and make that tooth as strong as it was originally. Okay.
So prevention, like I said, prevention isn't sexy, but it saves time, money, and pain.
How can I top that? That's awesome. That's it. That's the episode today for Your Filthy Mouth. Thank you, Dr. Chuck.
Thanks for watching them. Spread the word,
Yeah, absolutely. Don't forget to subscribe, too.
Thank you.
This has been Your Filthy Mouth, a weekly podcast about how what happens in your mouth affects the rest of your body. This is important information, so please share it with your friends. Don't forget to hit the subscribe button on YouTube, iTunes, and all the other podcast sites. And drop by yourfilthymouth.com to ask Dr. Chuck a question or find dozens of links to information about oral systemic health. We'll talk to you next week.